Good morning, everyone. Welcome to the December 29th Windsor-Essex County Health Unit Media Briefing. We'll have a few remarks from our CEO, Nicole Dupree, and then we'll take questions from the media. Nicole, after you.
Morning, everyone, and thank you for joining us. We thought we'd just start off with updating on our cases. So since our last reporting on December 23rd, Windsor-Essex saw an increase of 993 cases. The breakdown for that is 162 cases were reported for December 24th, 122 for the December 25th, 107 on the 26th, 262 cases were reported on December 27th, 153 were reported on the 28th, and for today we're reporting an additional 187 cases. As well, we continue to roll out our third dose vaccination strategy. To date, we've had 113,825 residents in Windsor-Essex have received a third dose or a booster. We just wanted to remind everyone that as of this morning, our website has been updated, and both the Nature Fresh Vaccination Center and the vaccination center in the West End at Hotel de Grace Hospital have both been added to our booking site. So residents are able to go onto our site and they can book appointments for both of those sites. They officially start appointments on January 5th. And that's it. We'll go to questions.
Okay. Thank you, Nicole. We'll start with the Windsor Star.
Yes, good morning to you both. I'm not sure exactly who this question's for, but have there been more lab-confirmed cases of Omicron in Windsor-Essex? And regardless of that, do you expect that it has become the dominant strain in our region by now?
Yeah, I think that we can ask the epidemiology team to perhaps review what we know in the latest data. There's typically a lag between when we get a positive test and what the variant, if there is a variant or not. I would anticipate that, I think the general view is that by the end of the month, Omicron will be the dominant strain, but we can try to give you more confirmatory information if you send us an email based on the data that's available to us.
Yeah, I'll just add that in our our update that'll be sent out, it will show the number of confirmed Omicron, but again, there is a delay and there's quite several hundred that are preliminary and that are still being reviewed. So we can give a more accurate estimation later.
Now that you've pulled back on contact tracing, asking those who test positive to inform their close contacts themselves, how has that helped the health unit with resources, reallocating things to the vaccination effort? What change has that allowed you to make?
So I can start. So yeah, it has made a little bit of difference for sure. We basically, and I think I've reported, we are mobilizing every available resource that can vaccinate. So all of our nursing staff that are able to vaccinate have been redeployed. And so over the last few weeks, we're transitioning all of those employees to support either SEERS or our mobile vaccination strategy or the other two mass vaccination sites that we're standing up. So it has allowed us to pull all of those resources away. We do still have certainly dedicated resources in case and contact, but it's allowed us to redeploy all our nursing resources, as well as additional staff that are needed to just, support logistics, registration, all of the other things that go along with vaccination. So it certainly has provided the ability to make that shift.
Thank you.
Any questions from AM 800?
Nicole, just in regards to the case counts, like you mentioned, 993 since last Thursday. Do you have an updated death count for our region during that span?
Yeah, Rob. So currently our overall deaths are 488, and according to our daily summary, there are no deaths reported since the 23rd, since our last reporting.
Okay, thank you. And then in regards to the vaccine rollout, I guess talking to your team, how did it go since the 23rd, since we last talked? Very busy at the mass vaccination clinic?
Yeah, it's continued to be very busy. As you know, we were booked, appointments were booked over the holidays. They, continued to have first and second doses come in. And I think, they're seeing around 3,000, maybe sometimes a little over 3,000 for most of the days that they're in operation. There was a slightly lower number of appointments on, obviously, the Christmas Eve and Boxing Day. But yeah, it's running really smoothly and keeping, they're keeping very busy, and we're excited to see, those other sites that will come online that we know will help certainly the West End and definitely the county with the Leamington site coming up.
And then one final question, Doctor, just in regards to the case counts, just under 1,000, and then on the 27th, like Nicole said, 262. We haven't had over 200 in quite some time. Just your message to the community. Obviously, like you always say, COVID's still out in the community right now. Just seeing these numbers, obviously alarming.
Well, it is concerning that we're seeing an increasing number of people testing positive. And the message remains the same, which is, among other things, if you're sick, stay at home, minimize your human-to-human contacts, wear a face mask, or when you're indoors or when you cannot consistently stay 2 meters away from other people. It is concerning. I think the one thing to think about is also, as testing capacity becomes diminished, which is where we're at currently in the pandemic, case counts are probably not the best metric to evaluate the burden of disease in the community. And we'll have to think as we go through the pandemic of other metrics that we may think more prominently, like the number of deaths, the number of people hospitalized, and the number of people in the intensive care unit. And that's going to be a shift in messaging as it relates to the pandemic. So I think that we'll wait for provincial guidance on this item. But with diminished testing, we're also going to have less ability or no ability to call outbreaks. It doesn't mean that there aren't outbreaks in the community, but the ability to arbitrate them or to make determinations about them may be more challenging in the context of a diminishing testing capacity. Another metric we may end up using is the percentage of people missing school or absenteeism rate, or the absenteeism rate at workplaces. And that may also give us a better insight into the number of people who might currently be affected by COVID. I would share that testing in other communicable diseases, testing is used in different ways, meaning this: for the flu, we assess the burden of disease of the flu not with testing for the most part, although we do test some people. For the most part, most people with the flu are not tested for it, and we make a decision to arbitrate a flu case by the symptoms that it presents with during the flu season. So that's just something to think about as we move forward in the pandemic.
Thank you.
You're welcome.
Any questions from CTV?
Yes. Hi, good morning. I'm just wondering, has there been discussion about what to do about schools, and should parents be using rapid tests before Monday if they are going back?
Well, I think the province has given a recommendation that people use the rapid test on a prescribed time interval. And so there's no, if parents, and it's a voluntary program, if parents elect to use the rapid test, that is an appropriate step based on the provincial guidance.
Thank you.
Any questions from CBC?
Yes, good morning. Is it at all possible to give an update about the outbreak ongoing at the Southwest Detention Center?
Given this is our first morning back, we haven't met with our outbreak team, so I wouldn't be able to give an accurate update on that outbreak, other than that we continue to monitor it as we would with any outbreak and meet regularly with the Southwest Detention Center officials. But I wouldn't be able to give any other update, and certainly until we've had a chance to meet with our team.
Any questions from Blackburn?
Yes, as you know, there's been some talk about kids not returning to school next week. Some provinces like Quebec are putting a pause on it, and Premier Doug Ford is expected to make an announcement this week about schools. What is your advice to parents right now in this time of uncertainty? This would be the time when they would be trying to line up arrangements with work. So what would you tell parents at this point?
Well, like everyone else, we're waiting for provincial guidance on this matter. And I'm hopeful the province will provide that guidance shortly. I think it's wise for parents to always think of the contingencies. So a couple of things that I would advise parents on. One is that if their children are sick, not to send them to school. And that's probably the one thing they can do to help manage the pandemic. If the kids are sick, do not send them to school. Because what we want to try to do is to prevent the number of introductions or potential introductions of COVID into the school community and the school population. I think it's not unreasonable to at least prepare for the possibility that the school openings might be delayed, but we won't really know that until we get here until we receive provincial guidance as it relates to perhaps pausing in-person learning. And on a personal level, I think that I think we should do everything we can to keep schools open for instruction. I think that's a really important public health priority. We have used containment approaches in schools to try to break the chain of transmission, but my preference would be to keep schools open, except under the most extreme of circumstances.
I guess what would those extreme circumstances be? I mean, we're now looking at cases. Today, you've announced we've had 993 since last Thursday, 262 on Monday. So what does an extreme example look like?
Yeah, so I'm going to give a sort of a long-winded and perhaps nuanced answer. The burden of COVID-19 right now, as it relates to hospitalization and deaths, is primarily among unvaccinated people. The goal of containment at school with school children is to break the chain of transmission. So if there's an exposure in the school, then to dismiss that cohort of children or isolate those children so they can't transmit it to a parent, and from a parent to a grandparent, and from a grandparent potentially to a vulnerable person who at this point in time, the people most likely to suffer are the unvaccinated and people that are vaccinated and are chronically ill. So the fact that we're having increased case counts in itself does not mean, or does not necessarily mean, that the best approach is to pause in-person learning at schools. It could be one of the options, but not necessarily the only or even the preferred option from my vantage point. Secondly, I think that the one thing we have to think of moving forward in the pandemic is the case counts probably, at least with the current variant, and the fact that testing is not available or is in diminished availability, that we can't use case counts to measure the burden of illness. I would prefer, and affirmatively, I would prefer to use the number of people hospitalized and the number of people in the ICU as the burden of illness, in part because with diminished testing capacity, those data elements are more verifiable and arbitratable. And therefore, that would probably give us better insights into the burden of disease in the community. We do have to wait for, nevertheless, we have to wait for provincial guidance on this matter, and then we can make local decisions to supplement that.
And one last question. People use this information to inform their decisions. On a personal note, my parents most certainly do look at case counts and deciding whether they're going to go to a certain community for lunch, etc. Are you concerned that by not being able to call out outbreaks, case counts, that people may be missing valuable information that they use to make daily decisions?
Well, a couple of thoughts. One is we don't always have all the resources that we want to achieve our public health goals. So we have to set priorities. And at this point in time, testing capacity is limited relative to the demand. That was true at the beginning of the pandemic as well. And we had to make priorities in managing the pandemic at the beginning based on the fact that testing capacity at that time was limited. Secondly, I do think that it is a shift in how we communicate to the community overall, and lacking that one data element, or not having that one data element available on a reliable basis or on a consistent basis is a challenge, and we will have to find other ways of messaging the burden of disease. And there are approaches that the province potentially could take so that people can get more local level data on the burden of disease. But I do agree that this is going to be a challenge in the transition period as case counts become not the substantive or primary metric of burden of illness.
Thank you.
Any additional questions from the Windsor Star?
Yes, Doctor. Do you expect to receive guidance from the province about what metric to use to measure the burden of disease? And do you think that is that conversation ongoing? Do you expect to receive that guidance shortly?
Well, my sense of it is that it'll probably be a number. It's always been that way. We've used a number of different metrics to measure the burden of disease. And now that we have diminished testing capacity and there's more of a focus on prioritizing vaccination over case and contact, I expect that there will probably be a suite of measures or a suite of indices that will be used to help articulate or summarize the burden of disease.
Thank you for that. And Nicole, will there be an epi summary presentation tomorrow at 8:30, or will it be like we're doing today?
So there will not be an epi summary presentation tomorrow, no.
Okay, thank you.
Any additional questions from AM 800?
Doctor, just in regards to the letter of instruction that you put in place at the beginning of December, so it's been about 3.5 weeks now. Has that letter of instruction made a difference for Windsor-Essex, or is it still tough to say, obviously, with the holidays? And any idea if it's made a difference for our area?
Well, we subjectively think it was the right decision to make based on the burden of illness, and ultimately the province adopted many of the same measures, especially the capacity limits. I think it's premature to conclude what the effect of the letter of instruction was, and I think we'll have to do a more fulsome analysis of the data. Perhaps you can ask that question in a few weeks when our epidemiology team is back full force, and we can look at the data retrospectively. But at this point in time, I wouldn't want to make any definitive inferences or conclusions.
Thank you. And just one final one. I know we asked you this question last week in regards to getting together for Christmas. I'm guessing the message is the same for New Year's and New Year celebrations?
Yes, I think that message remains consistent.
Thank you.
You're welcome.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
No, thanks.
Any additional questions from Blackburn?
Just one. There's also been talk about how we're now moving into the endemic stage of the pandemic. Are we?
Well, I think it's a complicated question. I think that COVID is going to be with us at some level indefinitely. It's not likely to be eradicated in the short term. And that's also true for other communicable diseases like the flu, that we manage the flu. We don't try to eradicate the flu, but we try to manage it. And I do think that this, we are likely in the public health world or the public health policy to transition to more of an endemic management of COVID from an epidemic management of COVID. I think that requires additional contemplation by public health authorities, but also the broader community about how we would try to make that shift from an epidemic management to an endemic management. But I do think that we are probably at that transition point or beginning that transition point.
Thank you very much.
Okay, thank you, everyone. This concludes our media briefing today. Our next media briefing will be Wednesday, January 5th. Thank you.
All right, all the best.